right, good evening, everyone. It is officially 5 o'clock p.m. It's Wednesday, March 19th, and that means we are hosting our Atlanta VA Women Veterans Program Town Hall. So we want to thank those folks that are physically in the room here at the Pete Wheeler Auditorium at the Joseph Maxwell Cleland Atlanta VA Medical Center. We hope that all of our women veterans are having a great start to Women's History Month. And I wanted to share a short but sweet quote from Amelia Earhart, who was an aviation pioneer and author. And it reads this: "The most effective way to do it is to do it." Right? And I know that our women veterans understand that and they know how to get things done. So without further ado, we're going to share a few admin notes from our staff. For those who are joining online and in person, please remember to refrain from sharing any personal health information. And for those who are joining online, please make sure that you don't include your birth date, your last four, anything like that when you are reaching out for help. We will make sure that we have some phone numbers in the chat, contact information for Miss O'Laughlin and the folks that present this evening, so that you can connect directly rather than sharing everything online, because that means folks will have access to the information since this will be posted on our YouTube page. So just wanted to share that situationally. I think the next person that you're going to hear from is Miss O'Laughlin. Right, with the agenda.
Hello, thank you all for joining. This is one of our favorite things to do. Twice a year, we do the Women Only Town Hall, and it's an opportunity for us to share information about gender-specific care and also to hear from you about what's important from you and to get feedback. So thank you for coming. We're going to have a lot of time for question and answers at the end of the program. The first person I would like to introduce is our director, Mr. Kai Mentzer.
Thanks for having me. So I got here in June of last year, and this is the first time that I've been available to be here for this. So I'm glad to be here. Thanks for having me. I don't have a lot of things. I just want to say thanks to the staff in the room for coming out and doing this. I know that it's a great opportunity for our female veterans to come here and share with us what their thoughts are, what we can work on. What we're doing well. And I know I was just logged in online. I think there's like 5 or 6 folks online. So for those of you online, it's a great opportunity for us to hear from you. And, we want to do better. It's my job as a director here to be the best VA in the country. And one of the things that I like to say is, as long as we're being better today than we were yesterday, we're heading in the right direction. So appreciate any feedback we get. And I'm glad I was able to join you all tonight, and look forward to the rest of the meeting. Thanks for coming.
Thank you. Okay, we also have some esteemed leadership here, and so I don't know if anybody in the audience that's attending would like to say anything, but Dr. Norvell is the Chief of Staff, and he is over the Women's Program, so thank you. And we have Connie Hampton, the Associate Director of Patient Care Services, Kendra Lee, the Associate Director of Access, Jennifer Jarib, the Associate Director of Operations. So what I wanted to do is just briefly say, again, thank you for coming. We have lots of time for question and answers afterwards. And the Women's Program treats the largest number of women veterans in the nation. We have over 28,000. And we continue to develop programming according to what you have told us that you need. And that is women-only groups, being able to have designated women health providers, and different resources for our maternity program and our mammography program. So please continue to ask your questions, to give your feedback, and to give suggestions. The Women's Call Center is really important. If you ever have trouble accessing care through your providers here, the Women Veteran Call Center is a national call center, and they have great capability of answering in real time. You can text, you can IM, and the phone number is listed here. Also, if you look at that QR code, that's the Women's Health Care Services benefits, and there's a lot of information online for you as well. So if you have questions that need to be answered pretty quickly, and these are the ways to get those answers. So we are going to hear briefly from Dr. Stephanie Brown Johnson, who is the director of our Whole Health Program.
Wonderful to be here just to talk a little bit about whole health with you all. And it's, really exciting to know that the VA, along with a lot of other national healthcare institutions and healthcare organizations, has really embraced holistic care. This is really the direction that healthcare is moving in, understanding that there's so many other modalities that can help us all to be healthier. So we fully embrace and acknowledge the power of all of our traditional medicine and the pharmacy and all the great things that we do. But now to bring in other modalities, things like yoga, meditation, Tai Chi, guided imagery, massage, chiropractic care, acupuncture, and fully recognizing and making those things available to veterans is absolutely wonderful. And in Whole Health, we think about and we talk about really putting the veteran in the driver's seat, giving them the tools, the information, so that they can really be very knowledgeable and have a lot of tools in their toolbox to really help them to reach the health that they hope to reach. We focus on the circle of health, and hopefully you've seen this before, but if you haven't, please, you can call us and our number will come up later and come to our Whole Health introduction class. But this circle of health really shows that we're putting the veteran, the person in the middle. It's focusing on you, and you see the words mindful awareness around that. And that's about that very powerful skill of spending time in reflection. We need to do that every day. And there's been so much research showing that when we quiet our minds and we get into a period of some nice deep breathing, that really helps us to concentrate more. It helps to reduce our stress level. And guess what? MRI shows that our brain even grows. Areas of our brain that have to do with concentration and emotional regulation are better when we do that. And then you'll see those 8 areas around the bubble. And those are the 8 areas that we focus on in Whole Health. And we have classes in almost all of those areas. So again, I spoke a little bit about mindful awareness. And this is some of the things that you can expect to gain from really incorporating this into your daily routine. And to help us learn that, we have an 8-week mindful awareness class, which really goes into depth and teaches you how to incorporate this into your life. So what does it look like to enter the Whole Health pathway? Really, it starts with a Whole Health introduction class, which allows you to take some time to really reflect on where you are and what matters most to you. And we hope that your providers in mental health and in primary care and other places are asking you that question, because that question can make a difference. It can make a difference in the direction that they advise you to go when they understand what's really most important. Then we look at doing something called a personal health inventory, which again takes you around that circle. And then we get to goal setting, because it's so important to have a goal. And it's great to leave a visit from a provider with a goal in mind, right? What am I going to work towards after this meeting? And that's what that goal setting is about. So we have classes like Taking Charge of My Health and Life, or working with a whole health coach that can help you and coach you as you work towards those goals. And then we have all of our well-being track classes. And let's see if we're going to go to the next slide. Here we go. And so one of them that we're very proud of is a maternity care mindfulness movement class. And this is for veterans that are either in the prenatal stage or postpartum stage. It's taught by a physical therapist who is also a very experienced yoga instructor. And this is a wonderful class for our lady vets who are during this time of life. We're also really excited that this same yoga instructor, physical therapist, is about to start a class called Mindful Movement for Pelvic Health. And this class will be especially for veterans with irritable bowel syndrome, pelvic pain, constipation, history of military sexual trauma, incontinence, sacroiliac, and low back pain. And it's going to be an evening class, so it'll be a virtual class that will be on Wednesday evening. So more to come on that. It will be starting in April, but I think it's going to be one that's going to help a lot of veterans. This is a list of some of the classes that we have, so you can see that we have a full array of tools of information, of experiences that can really help to fill the veterans' toolbox and help them to gain more speed along the goals that they have set for themselves.
Okay, and next we have, our last speaker is from VBA, and it's Keisha Williams.
My name is Keisha Blaney Williams, and I am a rating Veterans Service Representative at the Isaacson VA Regional Office in Atlanta. And I'm going to talk to you a little bit about compensation benefits. That's a really wide umbrella, it encompasses a lot of different benefits. The Veteran Benefits Administration at the Atlanta Regional Office, at the VA, we recognize that there are distinctive challenges and barriers that are facing women and service members and veterans. And the Women's Veterans Outreach Program goal is to increase awareness and promote the use of VA benefits and services and resources by women, service members, veterans, their caregivers, and families. So our benefits are not just for the veterans, but also the dependents and caregivers as well. Through conducting outreach and providing personalized support, the program seeks to remove barriers and encourage an inclusive environment for women veterans to engage with the Veterans Benefit Administration, or VBA. Some of the services that are provided by VBA are claims assistance and guidance. And at our office, you can either go in person as a walk-in. You can also file a claim online, but online claims have priority, that process. There's a system known as VERA, and that's the Visitor Engagement Reporting Application, that website that you can go to at www.benefits.va.gov/Atlanta/. So that would enable someone, if you want to make an online appointment with the Veterans Benefit Administration. And your appointments, you can do them virtually or in person, the ones that you schedule. We also work with development. Development means preparing the claims so that decisions can be made, okay? We also assist with the status of your claim, letting you know where you are in the claims process. Some features you are able to look online and find out different stages of the claim, but you can also contact us to find out that information as well. And we assist you with the processing of the claims, evidence submittal, and also specific to our women veterans, we have private interview rooms because sometimes there are issues that veterans may not be comfortable with discussing in the general area where claimants come. And if you voice that to one of the counselors that you have an issue, a claim-related issue that you'd like to speak with someone in person about, you can have that, you have that option, okay? And our Women's Veterans Coordinator, Military Sexual Trauma, also known as MST, our coordinators at our regional office are Alicia Davis, and that's her contact number, and Miss Frances Dargan. So those are our local representatives. And also at the Veterans Benefits Administration, the Isaacson Atlanta Veterans Benefits Administration, we have a public contact supervisor by the name of Miss Yolanda Gibson there. So that's pretty much all I have. Thank you very much for your time.
Good afternoon, everyone. My name is Dr. Jamia Pittman, and I am the Women's Health Medical Director. And it's so nice to see your faces here. And it's nice that you all were able to join us online as well. I don't have very much to say today except welcome and thank you. We have a mantra in the Women Veterans Program that we developed maybe about 5 years ago. And the mantra is listen to her, prepare for her, prepare for the woman veteran, and also to welcome the woman veteran. And so everything that we do is shaped around that. And so today's format is a little bit different than it's been in the past because we listened to the woman veteran and we understand that more time for questions is requested, is wanted. And so we're preparing that today. We also strive to prepare for the woman veteran, and we do that through all of the myriad of programs that we have, some of them that you'll hear about as some of the questions are answered today, but some of them I just wanted to highlight. We have expanded our postpartum care capabilities for the woman veteran, which is excellent. And that was necessary in order for us to have really a place at the table of reducing morbidity and mortality and to being able to address some of the things that we know put women veterans that are pregnant at higher risk for postpartum complications. And so we definitely focused our efforts on that. We've also focused our efforts on expanding some of the mental health services for women veterans. We listened to the woman veteran and her request for women's only mental health services and partnered with our mental health team, and Kathleen led the way, along with the mental health team, the social work teams, and developed some women's only specific mental health offerings. So that's excellent. And then, of course, Dr. Stephanie Brown Johnson highlighted our collaborations with the Whole Health. It's really the foundation of everything when you're able to understand that the woman veteran is at the center and that it takes a holistic approach to be able to care for the wellness of the woman veteran and for ourselves as well. So those are some of the highlights. And then the last part, so we prepare and then we welcome. We are working to have more of a presence of images of women veterans, presence of information for women veterans in our CBOX. We're visiting the CBOX and training the providers in comprehensive women's health care. We've come a long way, but we do understand we still have a bit of ways to go. And so thank you to all of you for being here, and we welcome your questions. But before we get into questions, just for a moment, let us highlight one of our signature events in the Women Veterans Program, which is our baby showers, our women's health baby showers. And so I'm stalling a little bit as we prepare for the video that's coming in 5, 4, 3, 2, and 1.
Army veteran, she's having a girl.
Congratulations on behalf of Soldiers Angels, and thank you for your service. Okay.
And that's for the mama.
Thank you so much. I have no idea how much it means.
For one, I am so grateful to have served in the Army and to be able to receive this benefit.
Congratulations, we're so happy for you.
Thank you. And we're here to support you during your pregnancy and postpartum.
I think that was the biggest thing that I needed to overcome, the mental health aspect of it, and you guys definitely have helped me with that.
This is my 4th child, and I've delivered all through the VA.
Another Navy veteran, and she's having a boy.
And every time I have another child, the services the VA offers is better.
I'm just grateful and I'm happy that you guys are doing this.
All the help that I previously was getting from the maternity team and everything, and the resources that they've provided me with, I really appreciate everything that they have to offer me and all the support that they have to offer as well.
Okay, thank you. Right now, we open the floor to questions. So I'm going to look first to our physical audience, and then we were going to go to our online audience for questions. So anybody in the physical audience have questions for us? Yes, ma'am.
Hi, my name is Rosalind Williams, peer specialist for the Trauma Recovery Program. 30 years retired from the best branch of the military, which is the Air Force. Thank you. So I'm here today because next month, April, is Sexual Awareness Month. And so I partnered with Ms. Lindsay Bailey, who is our MST coordinator for the Atlanta VA. And we're doing our annual clothesline program. And we're hoping that everybody will come out. It's really nice. We have T-shirts, and you write all over them. You can put anything that you want on it. And it just explains, it just helps women who have, or men, because we actually have men that show up too, to make T-shirts that have been through MST, okay? And so this year is gonna be on the 22nd and 23rd. And on the 30th, we're gonna be at Fort McPherson. So we'll have tables out from 9 to 3. on both of those days. And you come by, you could ask me questions, you could talk to her, you could just make a t-shirt. You know, and it's fun, and a lot of the veterans that come by, after I finish harassing them about what branch of the military they were in, they really enjoy it. They find that it's calming, it's soothing, and they like the fact that somebody knows what they've been through, and somebody is helping them to recognize it. And then we also offer therapy in my office, well, you know, in the trauma recovery program, for men or women who've been through MSTs. Okay? That's my shameless plug. Thank you.
Thank you. We appreciate it. Okay, so one question I have is, I'm a female veteran who's concerned about military environmental exposures, and I don't know how to get the list of presumptive issues. Where can I get more information? So I have two people that want to answer. So one from VBA and one from our PACT Act. Oh.
So we'll start with the pack.
All right. I'm Lauren Rush, and I'm our PACT Act coordinator, and thank you for asking that question. I work with the Veterans Health Administration, but we partner very closely with Veterans Benefits, and we know that both definitely rely on each other because our veterans have comprehensive psychosocial challenges, and we're here to meet those needs. So there's a couple places that veterans can go to get information about presumptive conditions. With presumptive conditions, you don't have to actually prove that condition was related to their service. They just have to be able to prove based on their military record as well as their medical problems. And those lists are either at va.gov/PACT, or we also encourage our veterans to download the Exposure Ed app. The Exposure Ed app is free on any smartphone, either through the Google Play Store or your Apple Store. And the nice thing about that is as presumptive conditions get passed by Congress, because that's who's in charge of passing them, then those lists are updated in both of those places. So rather than relying on a piece of paper, which we certainly do have located in our clinics and available to you, relying on the technology as a way to stay up to date. And we want to make sure that veterans don't miss out on presumptives that might have been passed since the initial PACT Act was passed in August of 2022. Thank you.
Thank you. Okay. All right, I have another question. I have concerns about some changes to gender-affirming care. Can you let me know what to expect? We have somebody from our LGBTQ+ program here. Thank you so much.
Thank
Nicole.
you. Hi, I'm Nicole Keating. I'm a LCSW, and I'm the Atlanta VA LGBTQ+ Veteran Care Coordinator. There's two others of us who serve the veterans here. And so on Friday, there was a rescinding of the VHA the VHA Directive 1341, parentheses 4. What that was is that provided gender-affirming care for transgender veterans and veterans with intersex disorders. So the VA rescinding that put a rescission in its place, and that rescission says that those services are no longer available unless you're already on hormones through the VA and want to continue it. The veterans that come out of the military who are on gender-affirming hormone treatment, they can receive those hormones through the VA. So in its place, basically, us VCCs are offering community resources to veterans. We're here to support you guys. And basically, you can reach us through the website. So you can just Google Atlanta VA VCC. Our names will pop up. Message us, we'll help you. And you can also, any of your mental health providers, PACT providers, any provider you have at the VA can submit an LGBTQ+ consult, and then one of us VCCs will reach out to you. We definitely want to support you during these times. We realize that transgender care, intersex disorder care is life-saving, and so we'll find ways to figure out how to support you guys.
Thank you so much. I appreciate that.
Yeah.
Okay. And for those of you that are attending virtually, please type your questions online because we have questions coming in multiple different ways. And if you are in our virtual audience and you have a question, please type it for us. Another question I have is, can you tell me what birth control options are available for me through the VA?
I can answer that.
Okay.
Hello, I'm Jana Payan. I'm a physician assistant in the GYN Surgical Clinic. Pretty much we offer all birth control that you would get in the civilian population. Everything from condoms are available. Spermicides, some of them have been recalled, but we do have an alternative spermicide. Birth control pills, Nexplanon, which is an implant that goes in the arm. All long-acting reversible contraception is available at the Atlanta VA. And tubal ligation, if that's if you're done having your building your family, that's available as well. And so pretty much anything that you can get in the civilian with your civilian providers, you can get at the Atlanta VA. Very accessible.
Excellent. Thank you so much. I just want to make sure if I have anybody else in the audience. Yes. Yes.
I just wanted to know if the VA has a breast health specialist, and so if the contact information is available for that person or persons.
Yes.
Yeah. So the question was if the VA has a breast health specialist. So yes, we do. We have a few people that are helping with breast health care. We have a breast surgeon, Dr. Mackenzie Johnson, who specializes in breast surgery, oncologic breast surgery. And she's very nice and very good. And we also have a breast health team, a team of nurse practitioner navigators and RN navigators that help to guide you through the process from the point of screening, if the screening should return abnormal, to the point of getting your diagnostic care, and if that turns out to be cancer, to the point of helping you to coordinate the treatment for the cancer. All of our mammography care does occur in the community at this time through VA Community Care, but the navigators are there to help coordinate that with on-site surgeons or, if necessary, community care surgeons. And so I'm a part of the breast health team. In addition, we collaborate with the National Tele-Oncology Service, which is a service where you can present cases to physicians, oncologists, radiologists across the VA for their expert opinion on the next steps in care. So we really do take breast health very seriously. It is one of the areas of high demand for services within the Atlanta VA because we do serve the largest population of women veterans in the nation at over 27,000, and most of the women do fall within the age range for needing breast health care, ages 40 and beyond. So hopefully that answers your question.
Dr. Pittman, we have another question. A veteran wants to know, how do I get a mammogram ordered?
Okay, great question. You're able to receive a mammogram by reaching out to your primary care aligned team, your PAC team, and asking your provider for a screening mammogram. This can occur through a myriad of ways. You can reach out through My Healthy Vet if you have access to that. You can reach out through calling the call center. You can reach out during your appointment, your face-to-face appointment. And so we definitely want to encourage everyone to get their breast health screenings in accordance with the American Cancer Society starting at age 40. And if there is a high-risk situation, whether it be a family history of breast cancer, most notably first-degree relative like mom or sister, you may be eligible for earlier screening than 40, or if you've had military exposure to substances that we're not sure if they may cause breast cancer, but we want to err on the side of being very cautious, you may be eligible for early screening, in your 30s, as opposed to waiting to 40. So those are some of the ways that you can reach out. And of course, Kathleen and I are available. I think Kathleen's number is listed on the web. And so if you reach out to her or the Women's Call Center, they will connect you with the resources and we can help to guide you from there. We do anticipate having on-site mammography care services very soon, very, very soon. And that's all I'll say. Yes.
Okay, another question I got was, I just found out I'm pregnant. How can I get help at the VA? So just to clarify, the VA doesn't deliver babies here because that's so specialized. But what we do is you let your primary care provider know, and they let our maternity care team know. We have 4 maternity care coordinators. 2 of them work with our pregnant moms from when they find out they're pregnant until they deliver, and the other 2 are postpartum, and they work with our new moms for that first year of motherhood. So you can tell anybody on your PAC team, your patient-aligned care team in primary care, that you're pregnant, and then they know how to contact our 2 maternity care coordinators, Tracy Kinsey and Kimberly Habersham. They're both registered nurses, they're both veterans themselves, they're both moms, and they just love working with our pregnant moms and connecting them with all types of care. And another question was, I heard that there are baby showers and food drives. And I actually see Zakia, and Adrian, our postpartum folks. So could either of you speak to how people can access that care?
Hello, good afternoon. So I'm the maternity care social worker in our maternity care program. And once you enroll in your maternity care services and connect with your maternity care coordinator, I'll reach out to all of our pregnant moms and try and identify what kind of needs you may need, whether that's a need for items for your baby or additional services for you or baby during pregnancy. And we've thankfully partnered with Soldiers Angels. They've been sponsoring our baby showers, which has been a huge help. And they've also been very gracious, also with opening up some slots for mobile food drives every month to our pregnant and postpartum moms. So it's really started with connecting with our maternity care team so we can kind of wrap you around in all the services that you may need and connect you from there.
Excellent, thank you so much. And not only do they have the outreach, which is all virtual, with our maternity care team, but there's also some groups as well. The pregnancy mindfulness group, there's a ROSE group, which is a education support group to identify and prevent postpartum depression. So there's a lot of great resources, and those were started by feedback from our women veterans who were saying that there were some difficulties they were having. They felt isolated, didn't have a lot of support. So we were able to create that programming. Speaking of new programming, somebody said that they're very excited about the pelvic floor therapy and would like to know a little bit more about that. So Dr. Brown-Johnson, could you speak a little bit more about that? Does somebody have a mic for her? Okay.
Yeah, so again, that class it's going to be virtual. And the physical therapist, yoga teacher that is starting it has designated that it should be helpful for many conditions that have to do with pelvic injury, pelvic discomfort, low back pain, irritable bowel syndrome, constipation. As she envisions it, it's going to be a 6-week session class, so it will meet every Wednesday evening at 6 p.m. virtually for 6 weeks. And right now we're going to start with a all-lady cohort, all-women's cohort. But if there are men that are interested, then the next 6 weeks she will switch over to a male cohort, and she will flip-flop back and forth as the need presents itself. So I hope I've answered the questions about that. It'll be an hour-long class, and it'll be starting in April.
And how would somebody get referred to that?
Yes, so if you are already in our whole health bandwagon, so you've been to whole health introduction class, you can just call our number or reach out to the whole health box on secure messaging and say you would like to be in the pelvic mindful movement class. If you haven't gone that way yet, if you haven't done whole health introduction, then we'd love to have you in the class, but we'd also like to get you to do the whole health introduction. And so we'd invite you to call again, and you can self-refer yourself into whole health. You don't need a consult, but your team can also place a consult for you. So you have several ways of getting to us, and we look forward to hearing from you.
Thank you so much. Appreciate that.
Kathleen, this is Mike in the booth. They do have a question on teams. It is this is from one of the viewers, how are mental health care professionals assessed to ensure they truly possess the empathy beyond just holding academic credentials? What steps are being taken to support mental health professionals who provide care to prevent burnout and ensure they're fully equipped to handle such traumatic cases due to the various trauma in the military? I understand how they must be well to help veterans heal well.
Well, that's a very impressive question. So, and please, from any staff that wants to jump in as well, I think that there are multiple levels and layers to that. I know that within the mental health service line, there are ongoing trainings and support that people do. The social work just offered, today there was a self-care for all clinicians that they could talk about burnout, signs of it, how to support one another, how to support their clients. There's also, the veteran asked about empathy. So we all know that during times of stress, we're all impacted, whether we're a staff person or a patient. And at the VA, we have a lot of veterans who work here and receive their care here. So that's another complexity. But I think the best way I can answer it is there's a level of accountability for the staff here. We come here and it's mission driven, and we know that there are a lot of changes environmentally, like every time we change leadership in the White House, that there will be changes and there'll be ripple effects. And so we understand that, we're prepared for it. Our leadership here, our director of our hospital is very transparent, and he talks to staff about any information that he knows that's coming down to impact the VA. And then us, our chiefs and our teams work with the staff to say, here's a potential impact. What can we do to support staff? What do we need to do to prepare so that we can help our veterans? So I think it's just an ongoing process that we all have to really look at and say, how can I be my best when I come into work today? How can I support my coworkers? How can I work with our veterans? One thing that I will say about working with the women veterans is this is the most gracious group. I worked in the private sector with men and women. I worked here in this VA with men and women, and now I'm working in this VA with just the women. And I'm just very impressed always with our women veterans. And I really hope that if and when a time comes that they have a concern about their care, that they know that they can talk to the patient advocate or they can talk to me as well. My information is on there. Our goal is to really provide care. There are times when we do a great job and we know it, and there are times when we fall short and we're trying to do better. So I would just ask that you give us opportunities to do care recovery when we do fall short, and that you know that the women's program really is listening and that we are trying to meet the needs the best we can. And when we do have limitations, we're going to let you know what we can do and what we can't do. So at least you have that information so that you can plan accordingly, like Nicole just did regarding some changes that came down. There's also sometimes we refer people to community support as well. So if that didn't answer your question, if you can kind of pop in any clarifying questions you have in the chat. Okay. And then there's also a question, and it kind of piggybacks on this, that there's talks about cuts to VA staff. How will that impact the Atlanta VA? And that's a really good question. There's discussion daily in the directors meeting about what changes do we know about, what changes are we thinking may happen, and how do we answer that call, and how are we going to address it? So sadly, we don't know everything that's going to happen over the talk about changing the workforce. But what we do know is that we have leadership that is working with the staff here at the Atlanta VA, and that we will be as transparent as possible with our veterans so that they can know what to expect. We really want to be supportive and open during this time of change. Okay. Any other questions online or from the audience? Yes. Dr. Amy Stevens from Georgia Military Women is in the audience.
You knew I wasn't going to let you get away with
I
that
know.
standing
I was like,
ovation.
okay, let's wrap it
I want
up.
to say hey to all my friends, and thank you for those that showed up. I thought there were going to be some more people here, but I'm glad that those that joined us. And I sent you some questions in advance. I think most of those were covered, but I think there was one about prosthetics that you didn't cover. But maybe before you get to that, I would like to say I truly support the staff here and everything that you do. I know it's a challenge, right? And we have about 5,000 folks that are in our group. They have a lot of questions. I can ask a few questions, okay? So I guess I want to make sure I cover the prosthetics one, because I think one of the challenges with VA healthcare is that a lot of times you don't know what you don't know as far as what's available. And so quite often we will post online that, okay, I got this item, or this item is available through maternity, or whatever. Like there was a big discussion about bladder protection products the other day, and it's nice because our group is only ladies and we talk about things that maybe we would not talk about in other venues.
Right.
But, it was quite interesting to see how many people were very impressed to know that we could get bladder protection. So those would be the kinds of things. And what I'm hearing is that typically primary care physicians normally are not all that cooperative on doing the referrals to get these extra things that you might need, that it's incumbent upon the veteran to say, I've got this leakage, or, can I get this? I think maternity care does a great job, because the kind of routine stuff. So once they're enrolled in maternity care, then they want everything, right? We know that. But so many times, and like the one person I think just wanted compression stocks that fit. And was saying, well, they won't give me what I want, so I'm having to go someplace else. And of course, gender-specific products sometimes, and certainly I am a veteran, I'm a Navy veteran, that for those that don't know. And, yes, sometimes the things are made for men and I have to send it back and say, no, this doesn't fit me, it's not the right thing for me. So can you address maybe getting items? I do have other questions, but maybe I could leave it for the moment. And then I'll have more questions.
The question about prosthetic socks, or compression hose, that a veteran had been getting them each year, and it looked like a new vendor was used, so that the size that she normally got with the other product didn't transfer and didn't fit as well. So what we need for her to do is call prosthetics, and to be able to just report that so that they can either help her use the previous product or adjust the size on that. So she definitely, since that's ill-fitting and won't accomplish it, that she can reach out to prosthetics. If you don't have the number, you can call the main line, the 404-321-6111, and ask them to connect her to prosthetics. If there's any staff online that has that prosthetics number handy, if you want to throw that into the chat for folks so that they can see that as well, that'll help. This did come up in a previous town hall where they talked about women-specific items. And so what the women's program did is we created a woman-specific order set. We wanted to make it easier for our providers to find those items, because if they're not prescribing it often, they might not remember what it is or where to find it. So we do have a woman-specific order set. So the PAC team, the patient-aligned care team in the primary care service line, they have nurses, social workers, mental health providers, nutritionists, pharmacists, and then the doctor. So in that PAC team, I would ask that our veterans, they can send a secure message, but they can say, here's my need. I need compression hose, or I need poise pads, or whatever that is, and talk to the team. And one of those team members will be able to help figure out that consult and who will place it and where it goes to. So hopefully that answers that.
If I just may add a little bit, You know, sometimes when we have forums like this, we learn new things and we learn ways to improve. We did recognize with our maternity care population that there was a need for us to improve our collaboration and communication with the prosthetics department. And so we formed this interdisciplinary chat, and there's an ease there. So now what I'm hearing is that we need to work on developing an ease with the PAC team, being able to understand, number one, the products that are available for women. So that's an educational communication element that we will work on as a result of this question. And then to ensure that the ease of that experience is similar to what maternity care is experiencing, because it works well.
Yes.
It works well. So thank you for that.
And then also, I did ask prosthetics to have somebody join us today, but it was last minute, so they will come to the next one.
Thank you.
Okay, go
Can I
ahead.
ask more?
Yes.
Okay, so I love whole health and recreation support, the chaplains and such, because I really believe a wellness approach is vital. Is that I am not a disabled veteran, I am a veteran who has disabilities. You know, and
Yes.
that's what I keep on saying to people, right?
Very good.
But the thing is, when you come to the VA and the focus is on the disability and trying to get care, it sometimes gets sidetracked. And again, one of the concerns is getting access to things like whole health. Again, that this is not something that is routinely offered in various clinics. And right now, certainly because of what's going on in the country and a lot of questions and concerns, a lot of people are very upset about various things. They've already potentially got mental health issues, and so we're trying to have activities where they can get out and hang out with girlfriends, have a good time, relax, but they don't automatically know about the whole health offerings or the fact that adaptive sports is available, or that the chaplains have a program where they'll take you to see the horses or whatever they're doing these days, right? And so maybe if somebody can address some of those things, is being able to get access to those programs, because the only way that they seem to know about it is if we post something where somebody's been to something that they like. And so the pelvic floor one is one that Kathleen and I had discussed, and I'm going to be promoting that, so I need your flyer when that's ready. But it seems to be a little difficult to get into the whole health arena to start with, getting started in it, because I think once people are in it, they like it.
Yes, and
But so-
there's so much, and they access
Right, so,
all
so
of it.
kind of some broad questions, getting into those alternative types of approaches, and then what kind of support are you offering, especially right now with the additional stress that's going on, to support coping and getting people focused so that we can do what we need to do, which is focus on taking good care of ourselves.
Good question.
Yes, excellent question, and very much to the point. Actually, I was just talking with Ms. Cook a little bit about ways to get the word out a little bit more efficiently about some of the whole health programs. So you're spot on in terms of your question. And one of the recommendations that she made was really putting more of our information out on the social media platforms that the VA uses, as well as posting our scheduled events on the VA website. So we're going to work towards that. You know, we're very much aware that there is some difficulty getting the word out, and we're going to take those two things and run with them, and also hope to eventually have more of a database where we can reach out to people that have been in the program before and say, hey, there's a new class, and we want to make you aware of it. So thank you so much for that question and for the words that you mentioned too. Thank you.
And if you all have recommendations for how we can reach more people, that is welcomed as well. And welcome your recommendations.
And here are the numbers right up here, so.
Oh, I was just saying that if there are other recommendations from our women veterans, we're welcome to listen to those recommendations. I've heard some people, have interest in a newsletter sent out, to patients, but whatever you think is something that we should consider, we're open to investigating it and partnering with our media department in order to get more of a presence. And so that would fall within the realm of welcoming the woman veteran to whole health experiences. And so there's an area for us to work towards with that. Thank you.
Could somebody address more about the Is there anybody here from mental health?
Hey, so my other role is Mental Health Front Door, where Mental Health Front Door, we're basically a mental health clinic. We do other random things too. But basically what we do is we help veterans get connected to mental health if they don't have a primary care team. So if they don't have a PACT, they come through us. If they do have a PACT, they use their PCMHI person, point of contact.
Which stands for?
Primary care mental health integration. So usually it's a social worker or psychologist that meets with the veteran, does a brief assessment, and then provides a mental health referral. So, and again, if they don't have a PACT, they can come to Mental Health Front Door. We're a walk-in clinic, so you just come in, we'll do a brief mental health assessment, and then we'll get the veteran referred to whichever mental health program makes the most sense with them. If the veteran is already connected to mental health, then they need to contact their mental health treatment coordinator and say, hey, you know, can you please get me a sooner appointment? That may or may not work depending on kind of how, what's going on in any given day. But every general mental health clinic has open access. So if it's business hours, you know, the veteran can walk into the clinic and be asked to be seen same day for mental health concerns. They're probably not going to see their clinician just because, you know, the clinicians are all scheduled with veterans, but they'll be able to see a clinician and be able to talk about their concerns. So open access probably makes the most sense if they're already connected to a team. But again, they can also come into Mental Health Front Door or reach out to their primary care team and ask to speak to their PCMHI person. The LGBTQ plus veteran care coordinators do have programming support groups for veterans who are LGBTQ plus. So for that, you just, again, reach out to any of us. Our contact information's on our website, or you can have any of your providers submit the LGBTQ plus consult. Anyone that's really stressed out about any recent changes, I definitely encourage you all, use your voice. There's patient advocates at the VA. File a complaint. Contact your congresspeople. You can do a White House complaint. There are ways and avenues to make your voice heard. All of this stuff gets tracked, okay? So use your voice, because even if it doesn't seem like it's going anywhere, this stuff is tracked. The data is tracked. So definitely encourage you to do that, okay?
And Dr. Stevens, I know you said what type of groups can help, and Dr. Brian Johnson, I wonder, do you have any idea of which whole health groups would be best for stress reduction?
Oh, wow. So many of the things that, wow. I want to say,
all of them.
Yeah, I kind of want to wave my hand around and just say, you know, it kind of depends, and we're all so different, right? So what works for one person and what appeals to one person will be different. We do have, taught by one of our psychologists, a stress management basics class, and that's like a one-time class. But of course, mindfulness-based stress reduction, which is an 8-week mindfulness meditation program, is just a fantastic way to get that regular habit into your routine and learn how to use it to help reduce stress. But a lot of folks love the yoga and Tai Chi. Both of those things can be used in that way. Virtual gardening, aromatherapy, writing to heal is another way that, you know, you can really let out a lot of things that are floating around in here that your brain is trying to hold on to, spill them out on the paper, and we talk about them. So I really think it's what calls you. You know, when you look at those list of things, it's what calls the person.
I know that there were 2 more people in the audience that had their hand up.
I just wanted to also mention, obviously, with the change in administration and increased stress in our society, in our world, it's really important that we all reach out to, right? You know, us healthcare providers can only do so much. And so we're so grateful to those of you here, to our peers that are here and also doing that work. Any veteran who's in crisis 24/7, 365 can call 988 and press 1. Any veteran who comes in to our primary care teams or PACT also is seen by nurses during triage, and they ask questions about their level of stress, about their safety in their home, a variety of things that are particularly poignant these days. And so, and also for veterans who may not be interested in mental health care, just due to our ongoing challenges combating stigma, there are social workers who also are available and assigned to every single primary care team. So we really focus on a multidisciplinary approach where we look at how can every single person that's part of our team and part of our extended community help and support the veteran, because none of us can do this alone. Thank you.
Was there another question in the back?
Hi, I'm Vita Brooks. I'm the State Women's Veterans Coordinator for Georgia. So when we talk about stress, I just kind of wanted to remind everybody that we do live in the state of Georgia, and Georgia has a lot of resources. And so I know that our primary partner is the VA, but after hours, sometimes we need GCAL. And they will go to someone who is in crisis. Don't forget that you can also, like she said, call 988. And sometimes that just helps to talk it out. So if you're having some difficulty, especially if you're a woman, getting connected to where you need to be, you can always contact me via email or phone. And then I will help you navigate through what you need to do. But I can also get you some mental health care through the state right away while you're waiting on an appointment to open up with the VA. And I can get you that appointment even on the weekends because there are some resources within the state that can help stabilize you. So we're in this together, but I really believe as we are navigating all the changes, all the new stuff, the biggest resource we have are each other. So you're saying you have 5,000 people with women, with the Georgia Women Veterans. If those 5,000 people talk to one person who is not part of your group, we now have 10,000 people that we're touching and making sure that they're okay. So I think at this time, really, as we're trying to figure out how to navigate a new budget, how to figure out what we're going to do without certain grants, we are going to have to do what we always did and take care of our buddies. And I think as this community, and I rely on a lot of women veterans within the Georgia Military Women group to, kind of encourage me and uplift me. And I think now our community groups are going to have to do more to support each other. The VA can't do everything. And as we decrease and go through the ups and downs of this, of whatever's going to shake out at the bottom, I think it's going to be us who keeps us alive by supporting each other, encouraging each other, and supporting our people within the VA. They don't make the laws, they don't make the changes, they're not making those decisions. So our hostility should not be towards them because they're trying the best they can. But we are all in this together, and the state of Georgia is standing with the veterans. So if you need something, it's going to be a collaboration. And I just think we just got to make it work.
Vita, thank you so much. And actually, talking about collaboration, we have an event coming up. Did you want to speak to that real quickly?
Yes, so I am so excited because we have an event on Friday the 28th, and we are going to do a women's health symposium. We're going to talk to each other. That's really what this is about. This is about us getting together, talking to Whole Health, helping veterans navigate how to connect to all of the wonderful things that are happening here. So the VA is coming out and supporting in a magnificent way. We also have some state people who are coming. And we're just going to really talk to each other, do some roundtable discussions, sit down, mingle with each other, encourage each other. But this is a very specific, on purpose women event where we're going to kind of unzip all of the resources that are here, that are within our VA, and we're going to say, did you know this? And then we're hoping that the people who show up and come are going to then walk away with, oh, I didn't know that. I need to tell a friend. So please check out the Georgia Georgia Department of Veteran Service website. The flyer is up. Again, contact me if you haven't heard about it. Check, and we will make sure you get the flyer. But this collaboration is something that I am so excited for, because I'm going to have the whole women's program team out, and it's really going to give all of us women veterans here in this area the opportunity to go out and really learn. And this is kind of my beta test. And Kathleen is like, she's like, Vita, you know it, let's just try it, right? And then so the goal is for me to hit all the other VAs and do the same thing, so that we start connecting our women veterans to the appropriate resources within the VA. Because there's a lot of stuff on them VA streets that's not right. So we want to bring them in and tell them the truth. So that's it. And since I had the mic, because I promise I'm going to sit down. But I just want to say, so Rosalind, I try not to like her, right? Because she's always doing like amazing things, and I feel like her head is getting bigger and bigger and bigger. But I just want you guys to know that as a representative of this Atlanta VA, Miss Williams, she is out there in the community and she is just doing her thing. I hear about her all the time. Your community loves her, and she's doing stuff out there. And I just wanted you guys to know. So thank you for Rosalind.
Okay, I see that we have run over time, so if anybody in the audience has one quick final question, if not, we're going to go to Dr. Brown Johnson for the wrap-up, a mindful moment.
Okay. Let's see, I need my hands. Yeah. So this has been amazing. The information that has been delivered, the questions that have been asked, and the answers that have come forth, and the passion and the commitment. I think you can feel it, and hopefully it comes through for those of you that are joining us virtually as well. So I'm so glad that I was able to be here, and I know, I think we've all learned a lot. Just for closing out, I just wanted to just kind of give us a calming closure. And so first I'll just ask you to connect to your breath. Again, just reminding you that as we work with our breath and we slow our breath down, it helps us to reduce our cortisol levels and really helps to restore us to a very calm state. So taking a nice deep breath in and then breathing out a little longer than the inhale. So you might come into 3 and out to a 6 count. Let's take a few breaths like that. And while you're breathing, I want you to imagine that you are in a warm pool of water. And that would be especially nice because I think it's a little cool in here. But imagine that you are in a warm pool of water and that it is coming up to about the mid-chest level. You are quite safe. You're in a very safe place, a very calm and peaceful place, and the water is just really enveloping you and soothing you. And so we're just going to do a brief Tai Chi movement, and that is parting the water. So imagine that you're placing your hands in front of you and your hands are lying on top of the water. And you're just going to push the water forward with your hands and then bring it back. Okay? Now we're going to put our breath into that as well. So we're going to breathe in and then we're going to breathe out. Let's just part the water. Remember to put your breath in it. And now just imagine that really what you're doing is You're just moving all the obstacles away that are in front of you and clearing the path for you to go forward and do all the things that you've been called to do and all the things that you need to do. You're just parting the way. Let's just take another nice deep breath. Thank you.
Thank you for everybody who joined. And this concludes our meeting. We will be ending now, and we appreciate you. Thank you.